casualties, including almost 400 deaths and 500 injuries, of which majority of them were women and children. This is just seeking either water or seeking shelter or returning to their place of residence. So clearly, UXOs and unexploded ordinances combined with the remnants of war, a public health risk that we need to be very clear that the health sector needs to be present and have that ability to provide support. On the disease side, certainly cholera and acute watery diarrhea. To date, between August and December of last year, we've already recorded more than 1,444 suspect cases of cholera associated with 7 deaths. This is particularly in Latakia and Aleppo, particularly around displacement camps. We know that when cholera gets hold in camps, it can serve as a brush fire, increasing both morbidity and mortality. And then, of course, bring your attention to malnutrition. A recent report by Save the Children was citing more than 50% of children under 5 are not receiving treatment, but are severely acute malnourished. And here again, from a public health standpoint, we need to be able to watch that risk and intervene and save those children. It's already a dire situation that report points out 50% of children are not receiving the treatment for SAM. But more importantly, there's at least more than 416,000 children in Syria that are at risk for severe malnutrition. Again, on maternal and child health care, we have 50% of maternity hospitals in Northwest Syria have suspended due to financial cuts that we're witnessing globally, but are being really apparent in Syria. And then, of course, last but not least, when we look at the system overall, that what Mike Ryan said yesterday in our intervention is the heartbeat of a nation. And we need to make sure that that heartbeat continues. We had really uncomfortable stories talking about how that system hasn't had that investment. 50 to 70% of the Syrian health workforce has left the country, putting a strain on those availability of services that are needed, as Adam has spoke about. And then, of course, the workforce combined with the infrastructure. So whether it's hospitals like in Al-Razi, hospital in Aleppo, or whether Homs Grand Hospital and Homs, these are what require investment going forward. And I think as Adam has laid out, we have a challenge as a humanitarian community to be able to address acute needs, those returning. And again, we welcome the lifting of those sanctions because we know that will facilitate the confidence of individuals wanting to return home. That challenge of where they return in terms of what they have in terms of basic social services, in particular health. And then, of course, looking forward. And I think as Adam clearly pointed out, we need to balance those acts of the support now, but looking forward in terms of reconciliation, reconstruction, and recovery. So that's on Syria. Back to you.
Thank you very much, Altaf Musani, Adam Wasorno. Thank you both for bringing the spotlight back on Syria. Obviously, the humanitarian situation there, very important in its own right and for the stability of the whole region. But it's it's sort of not been a focus so much of late. I'm going to wait and see whether we have any questions. I've got Olivia from Reuters. Please go ahead.
Hi there, morning all. Thank you for this briefing. Just a few questions. If I could just start with Altaf, just on the 50% of maternity hospitals in Northwest Syria being suspended due to financial cuts. Could you just give me a few details on when that was suspended, what impact that's having on pregnant women, and if you have any numbers on how many women that is affecting. And also you mentioned there about the 900 casualties and 400 deaths of people returning home seeking water from unexploded ordnance. Are you just able to give a time period of when those figures were reported? And just a broad question, both for Idem and Altaf. In terms of funding coming through for Syria, are you getting enough? You said you could do more if you had more, but in terms of like base level, what you have, is it sufficient, or are you kind of quite gravely concerned that you're not going to have sufficient means to help with what is clearly a major process ahead in terms of getting Syria back on its feet? Thank you.
I'm just going to jump right in here so this is a UNFPA report, and the suspensions have been from late last year. So it's not just the financial cuts that have been announced as of this year, but and Adam will speak more to some of our overall humanitarian financing. Our appeals continue to be underfunded, particularly in health. And so we have several milestone moments whereby ODA continues to shrink, but this is having a deep impact on making sure that the financing needed for our frontline partners, particularly these facilities that I spoke of, and just to cite the report here, is 50% of maternity hospitals in Northwest Syria suspended since September 2024. And this leaves pregnant women facing the grim reality of without giving birth without providing the essential medical care. The report further states that there are 4.1 million women of reproductive age in Syria as of January 2025. When we look at risk, whether it's to women, children, we continue to address that risk in a very dynamic status to be able to understand who is seeking healthcare, when are they seeking healthcare, and what are they seeking healthcare for. Obviously, it gets very complicated when the healthcare system doesn't have the investment to be able to provide those vital services. And our challenge is always that there might be barriers to care. There might be physical barriers, there might be financial barriers, there might be social barriers. And so our challenge has always been, as healthcare providers, get those who need healthcare to the door, and then we need to make sure that that system, as they walk through that door, is comprehensive and is not just addressing a single disease, a single health condition. They might have other family members. So it's really important that we track this, particularly for women of childbearing age, in terms of an impact. And then again, on the UXOs and explosive remnants of war, here we've tracked this since December 2024, and citing the data that at least 900 casualties, resulting both in death and injuries, majority of women and children. And this is something that we're seeing. Adam and I, as she pointed out, went to a host community where we saw a lot of returnees trying to come back. And as more come back, we had an interesting conversation with the Syrian Arab Red Crescent Society. They're frontline partners. They're providing mobile care in these environments. And so they need to be able to refer these children that either are looking for water, looking for food, trying to manage their land, who don't understand what the remnants of war look like, or UXOs in particular, and often are just again an indirect impact, but having a direct impact on their lives and livelihoods. So long story short, making sure that we have the ability to work within the system, and we've done this throughout the world in various contexts where UXOs are present. There's mine education, there's mine awareness, there's actually picking up these mines using the mechanisms that have been tried and tested to remove them from the ground. So there's an entire program that is associated with that, and we need to make sure that we integrate that program, as we've done in many parts of the world, with the healthcare system, so that as and when situations, as I cited with the 909 casualties, the healthcare system is able to come in and stabilize quickly and provide the necessary rehabilitative care and post-op care, post-surgical care that it may be required as a result of being exposed to those UXOs. I'll hand it over to Adam.
Adam?
Thank you. Can you hear me? Still echoing, I suppose.
Yes. Yeah, no, it's fine. Go ahead.
Okay, thank you. Thank you for the question on funding. And I think, Altaf, you've covered quite a few specificities there. I was looking at the Security Council statement by my colleague Ramesh Rajasingham on the 21st of May, and he said the UN and its partners are appealing for 2 billion to reach 8 million people from January to June. Today, we've received only 10%. So that was out there in the Security Council. If you look at our statistics, we are struggling. We, as Secretary General has said, we're doing less with less as the UN. And Under Secretary General Fletcher has said we are overstretched, under attack, and underfunded. And this is, you see it on the ground. Altaf has talked about some of what we saw. If we had more funding, we could do more. Last year, we asked for 4.2 billion. We received 1.5 billion, and we were able to reach millions of people. That was 35.4% coverage. This year, as of almost June, only 10%. In the council statement, he also talked about in northwest Syria alone, 40 of 83 protection centers have closed, leaving a gap in services for vulnerable people, even at a time when they are returning home. The people of Syria need our support. They need funding. They need resources to be able to rebuild their lives after a lot of years of disruption, conflict, and suffering. Over back to you. Thank you.
Thank you very much. I've got a question from Nick Cumming. Bruce, go ahead, New York Times.
Yeah, thank you for the briefing. A question for Adam. The lifting of sanctions sounds like kind of a silver bullet that should trigger an automatic sort of improvement in the situation. But I'm just wondering how quickly you expect to see tangible results from that, and is there a timeline for freeing up restrictions on particular sources of funding that will have an impact on your programs in Syria? And secondly, a question just for Altaf Husani. You mentioned back on these UXO casualties, you said since December 2024, up until what time? Where are these particularly concentrated? I mean, is this spread sort of pretty much equally across the country, or is it very much in sort of areas that were the sort of the centers of conflict in the center of the country? If you could just enlighten us a bit on that. Thank you.
Okay, thank you.
Go ahead.
All right, thanks a lot. Thanks, Nick, for your question on the sanctions. I think we've seen that in different contexts, and for sure, back in November 2023, when I was in Damascus and the previous times, we saw firsthand the impact of our inability to take basic, medical, and here Altaf can speak to it, MRI parts into hospitals to be able to do scans, to be able to, treat people as necessary. We've been asked as humanitarians the impact of sanctions. We've briefed the Sanctions Committee in New York, my colleague Michelle Saad and I, in different fora to different member states on the impact of sanctions. And we've been clear on one thing. We as humanitarians stay away from the fray, we stay away from the politics of it, but we do see that if things are lifted, if to the daily life of the person in Syria, what we saw, the daily people trying to get back to their lives, the day the sanctions were lifted, the Syrian pound went up a bit. It improves the daily lives of people. We don't have a timeline, and here, of course, the member states, the negotiations as necessary at the New York level, at the Geneva level, at the regional level, and also capital level will be necessary. You do raise an important point. We are trying to understand the impact. There are different intricacies related to that. There's the CESA Act, the extensions related to that. So give us time to unpack maybe the timeline, but I can certainly say that the very day it was lifted or the next day, we could see the impact, even the hope in people's eyes on what this means, because the sanctions have loomed dark over Syria. And here I'm not talking about the politicians, I'm talking about the daily lives of the Syrian, from that mother who just wants to make a living to that father who just wants to protect and take care of his family. So I know it's not a clear, finite response and answer, but we believe that we need time to unpack the consequences. So that's one. Two, if you look at sanctions globally, as I said, briefings, the Sanctions Committee on Somalia sanctions, on Central African Republic sanctions, on Syria sanctions, we are really trying to bring the empirical evidence of the impact. And it takes time for humanitarians to sometimes muddle through that political water. I'm really hoping that with the economic sanctions lifted, we'll also see the impact on our goods and services in the country, on the cost of doing operations in the country, on the ability to move goods quicker into the country. So it will take time, but I believe the people of Syria are hopeful that this will change their very day lives in the country. Over back to you, Altaf.
Yeah, thank you. I think just practically, as Adam has said, sanctions on healthcare. So this is decades without investing into the health system. And as I cited earlier, healthcare workforce, when they don't have the necessary equipment and means to provide life-saving interventions, over time we have seen, as I mentioned, 50 to 70% of the healthcare workforce has left the country seeking other opportunities. Let me be also very practical. When we talk about MRI machines, CT scanners, laboratory equipment, all our ability to ensure the latest equipment with the ability to upgrade softwares in order to function in several settings has been constrained by sanctions. Of course, health cluster partners, including my own institution, continues to work through the system to apply for exemptions and licenses. However, the sanctions have had a deep impact on the functionality of healthcare, and we've got some data points on that. And then just on your issue of UXOs, this is something that we've been tracking from late last year, December 2024 to present. Of course, we as healthcare providers don't have a mapping of where these UXOs are. If we did, certainly we would raise the caution with those who do mine risk education and community engagement to be able to cite very clearly no-go areas. However, we're starting to see the admission rates and consultation rates and emergency rooms increase, those being affected by individuals. And as I cited earlier, children and women going about their daily life, trying to get water, trying to get food, trying to rebuild, are walking through agricultural lands, roads, potentially rivers, where we will not have an idea of where the UXOs will be present. However, a clear and present danger, a part of a wide range of public health risk, as I cited earlier, whether it's cholera, whether it's trauma, whether it's mental health, psychosocial support, whether it's the need for maternal care to ensure that women of childbearing age can deliver safely. This is a wide range of public health risks that we need to monitor, but equally manage from a health perspective. And I think, as Adam said, the investment in the health system in Syria is the investment in the people of Syria, which is the investment, as the presenter cited, will stabilize Syria going forward as well. So the window is now, and we're certainly appealing for and calling for that investment case now to deal with returnees, to deal with host communities, to deal with the health system. And what we witnessed firsthand, tremendous resilience, tremendous opportunity, but we need to do this quickly.
Thank you. I think, Adam, did you have a point to make on funding? And then we'll go to Ahmed from Anadolu.
Okay, thank you so much for this briefing. My question for Adam, do you have the latest number that shows how many Syrian refugees return back to their country from neighboring countries since the fall of Assad regime? And also, if you have, I would like to learn that specifically from Turkey, where you are in. Thank you.
Thank you. Can I?
Please go ahead.
Thanks a lot. I didn't get the colleague's name who just asked the question or what agency, but I will proceed. I'd mentioned.
Okay.
My name is Mohammed from Turkey's Anadolu News Agency.
Mohammed, thanks a lot. So the trends, as I mentioned earlier, is about over 1 million internally displaced people who have returned to their areas of origin, and over 500,000 refugees returning from neighboring countries, as reported by UNHCR. So a good stream of returns there. I will speak to Gaziantep very quickly, but I also wanted to mention the absolutely phenomenal work that the civil society organizations, Syrian Arab Red Crescent, and local Syrian NGOs, particularly women-led NGOs, have done and are doing. And I really want to salute them. This is part and parcel of our humanitarian reset, but also from 2016 localization and the localization agenda. There's a lot that they do. They are the unsung heroes of course, this response. And I really wanted to do that. I also wanted to zero in a bit on the pooled funding system, either the Central Emergency Response Fund or the Syrian humanitarian funds based in Gaziantep and also based in Damascus. We're trying to consolidate, and here we're able to have a lot of flexible approaches. We're able to also support locally led actors, particularly these NGOs that I've mentioned. Very briefly on Gaziantep, I also want to highlight the phenomenal efforts that the colleagues have done over the last, since 2014, the lifeline that they have provided. I have been impressed by the briefings I've received here from our partners. Since 2014, over 62,000 trucks, UN, have been dispatched from Turkey to northwest Syria. A real good collaborative effort also from the government of Turkey and their support to the Syrians in this regard. Good efforts also by the people of Syria on the other side. Good efforts by all humanitarian actors, really wanting to salute them. Since the start of the year, 1,000 trucks have loaded and entered Syria from Turkey. So we're looking at how we capture all this experience and everything that they've done here and responsibly wind down the cross-border operation. It won't close overnight. It's taken from 2014 to now. We need to responsibly look at the best efforts, of course, in collaboration with the interim authorities and also the government of Turkey. I'll stop here. Thank you.
Thank you very much. If there are, I'm going to look and see if there are any more questions. If not, I know that both our speakers are also able to take questions on the coordination and response model in Lebanon. In the interest of time, I would just ask you maybe perhaps to channel those through, if you have questions, through Jens and Margaret, who are here. And if possible, if there are no more questions online, I'd like to thank both. Oh, sorry, go ahead, Olivia.
So I just actually had a question on Gaza, but I don't know if you want me to ask that later after the other speakers.
Sure, go ahead if you think that you have. I mean, yeah, but by all means, go ahead.
Thank you. It's just on the point of aid distribution in terms of security. If OCHA could just detail what plans are being put in place to ensure that distribution is safe, because there's been concerns raised about looting. And also, there's been reports this morning that some bakeries are reopening now that some flour has gotten into the enclave. Any details on that from OCHA would be great. And also just confirmation at this stage, still no medicines getting in, right? It's still just food, from what I understand. Just confirmation of that, please. Thank you.
Thanks, Olivia. I think, Jens, do you want to? Right, okay. Secretary General will speak on this. So you want to just leave that for now? Yeah, thanks. So yeah, I think we'll just defer if that's okay. Yeah. All right. Thanks so much. Thank you. If there's nothing more on Syria or Lebanon, then I'd like to call Saif Magango from Human Rights from OHCHR. He's going to speak to us about South Sudan.
Good morning, everyone. Good morning. Can everyone hear me? Good. Yeah. We are warning today about a real risk of a further deterioration in the already dire human rights situation in South Sudan. This follows a sharp increase in hostilities between the South Sudan People's Defense Forces and the Sudan People's Liberation Army in opposition and their respective allied fighters. At least 75 people, civilians, have been killed and 78 injured since the latest hostilities broke out in February. Thousands have been displaced. The latest fighting broke out following a series of armed attacks in Nassau County in Upper Nile State in February that were attributed to the White Army militia group. High Commissioner Volker Turk is urging all parties to urgently pull back from the brink and to uphold the 2018 peace agreement. He is also calling on all parties to protect civilians and civilian objects and to facilitate humanitarian access in line with their obligations under international law. We are also concerned by the arbitrary detention of dozens of politicians linked to the SPLMIO, among them the country's vice president, ministers, and members of parliament. At least 55 high-ranking government officials affiliated with the SPLMIO were arrested across the country between the 5th and the 26th of March, many of them without arrest warrants or due process. All those arbitrarily detained must be immediately and unconditionally released. We appeal to the authorities to also take prompt, effective, and meaningful steps to halt hate speech. Thank you.
Thank you very much, Saif. Any questions for human rights on South Sudan? Thank you very much.
Thank you.
We have a lot of people standing by patiently. We're going to go to Maputo next, where the Mozambique representative for the UNHCR, the refugee agency, is based. He's Xavier Creash, and thank you. You're here to introduce him, I guess, in a better way than I can. Go ahead, please.
Thank you, everyone, for joining today's briefing from UNHCR. We have very great opportunity to hear from our representative in Mozambique, in Maputo, Xavier. The country that facing multiple crises, but we rarely hear about the crisis that a lot of IDPs, internally displaced Mozambican, and also that the country hosting refugees, which also hit by a cyclone and drought several times during the year. So please, I will give a floor to our representative so that you can have a deeper understanding of the situation at the moment.
Good morning, everybody, and thank you for this introduction. You did hear recently about Mozambique, but you heard about Cabo Delgado because it has one of the world's largest gas reserves, and many multinational companies are setting their base in Cabo Delgado, and they are living side by side with IDPs, because Cabo Delgado is also the epicenter of significant armed conflict for the last 5 years now, and already more than 1.3 million persons have been displaced by the conflict. Regretfully, we see recently a surge in attacks against civilians, civilian infrastructure, civilian services, and we see the number of forcibly displaced people raising 25,000 new displaced in the last days or weeks. But in addition, the areas impacted by the conflict are growing. More and more districts are affected, even new provinces are affected by the conflict. And last week, we saw attack in the province of Niassa with new displacement. And this development, of course, intervened at a moment of extreme financial constraint for all humanitarian actors in Mozambique, not only for UNHCR. And we have this very difficult equation, no? Needs are increasing, but budget are reducing. And as my colleague said in Geneva, Mozambique is grappling with a triple crisis. I did mention already the armed conflict and the forced displacement, but there is also a recurrent extreme weather events, drought, but cyclones who have been hitting Mozambique back to back, 3 major cyclones in the beginning of the year, hitting the same areas where forcibly displaced people had found refuge and protection. These people displaced by the conflict have been hit a second time now by the cyclones. And the third crisis is the civil unrest, which has developed following the post-electoral elections. Let's not forget that as a result of the civil unrest, thousands of Mozambique fled as refugees to neighboring countries, in particular to Malawi, Most are back now, but it is a reminder of how fragile the situation is. And in this very challenging environment, UNHCR is struggling, like other actors, to respond effectively to the needs. Production services is significantly impacted. Our capacity to support women, girls affected by gender-based violence, our capacity to provide mental health, our capacity to provide civil documentation with the government of Mozambique to the people displaced is seriously impacted. But we're not only concerned by the response for IDPs, we're also concerned by the response to refugees. Mozambique has currently 25,000 refugees on its territory. The government of Mozambique has opened its border, has opened its schools, its health centers to refugees. They mainly come from Democratic Republic of Congo. You know the situation currently in Congo. And regretfully, UNHCR may have to suspend its support to these government services due to the financial situation. We don't think it's fair nor sustainable to ask the government of Mozambique to bear on its own the burden of forced displacement, whether IDPs or refugees. We're having a government, we're having a population, communities who have demonstrated commitment, solidarity, hospitality in favor of the displaced people, and it's not the time to abandon them. In addition, this triple crisis I mentioned is fueling a very difficult financial economic situation. The food price on the rise. They were already very high, but they have increased by 10 to 20% in the last weeks, while incomes for the people have gone down. So we are afraid that this economic crisis might be the tipping point. The perfect storm is coming. It's not the moment to turn away. It's the moment to support Mozambique. It's the moment to support the people of Mozambique, to protect displaced population, to bring solutions and to prevent. It is not the moment to sit on our hands. Thank you very much.
Let me see if there are any questions in either online or in the room. I don't see any at the moment. I don't know, Eugene, if you have anything to add. Okay. Thank you very much for connecting with us from Maputo. Stay with us. We've got several more speakers and lots of questions. Next up from UNDRR, that stands for Disaster Risk Reduction. We've got Genty Kirschwood, who is the head of Global Risk Analysis and Reporting there. The floor is yours.
Thank you very much for this opportunity, and I'd really like to commend the work of the humanitarian colleagues who have spoken before today. And I would like to draw attention to the fact that I think in each of those cases, there was a recognition that at some point in that erosion into humanitarian need, there was an issue of a natural hazard, whether it was drought in Syria, whether it was the floods in Mozambique or in South Sudan. It's clear that we live in a complex age. And I'm here today to talk to you about a report that we will be launching on Tuesday, which is really talking about investing and financing for a resilient future. And that may sound a little bit theoretical, but for those of us for those of you who were born in 1990, you had a 63% chance of living through a 1 in 100 year, a catastrophic flood in your lifetime. For those of you who were born in 1990 but are now the parent of a child born in 2025, your child will have an 86% chance of living through a 1 in 100 year event. And those events are affecting us all, but of course they are affecting the countries that are already struggling with other challenges like we've heard today the most. And so what our report that is coming out on Tuesday really dives into is the fact that we have been chronically underestimating and under measuring the impact of disasters on our global system and on our global progress towards sustainable development. We the report outlines how the direct costs of disaster losses have already increased significantly. They have doubled in the last 20 years. But at the same time, what we're also seeing is that those costs, which are 200 billion a year, are in fact only a fraction of the real costs. And the report outlines how some of the kinds of cascading effects that we've heard about earlier in this briefing, but also around ecosystem challenges, around healthcare, education, labor impacts, mean that the real cost of disasters, as we're starting to measure them, are actually closer to 10 times that amount, $2.3 trillion annually. And the tragedy is most of those costs are preventable. And so what the report digs into is how we can better align our financing systems, how we can better use public and private investment to make sure that we're optimally reducing the burden on governments, we're enabling facilities for sustainable long-term investments that can help prevent elements of displacement and humanitarian need. And we're trying to make sure that as we move into a complex climate future, we have the risk analytics and the facilities and the know-how to be able to create a sustainable future together. The report outlines different spirals of unsustainable development, which are contributing, for example, to increasing debt burdens, slower recovery times in countries that are already vulnerable, and are also contributing to a unsustainable and unsupportable humanitarian response repeat cycle. The report calls for the international community, governments and communities to look at some of the tools and opportunities and case studies of success around the world of where resilience building is able to reduce costs and it's able to create a funding environment that can allow countries to reduce their debt burden and continue on a path to more sustainable development. I'd also like to note that that many of the topics raised in the report, many of the maps, many of the analytics, which have been developed with obviously input from the leading organizations around the world, including IPCC partners, some of the great scientific networks. This work is a collaboration around a better risk understanding framework, and much of this work will also be showcased at our upcoming Global Platforms for Disaster Risk Reduction, which is being held from the 2nd and the 6th of June here in Geneva, hosted by the government of Switzerland. So I would like to really request all of you to consider joining us at the Global Platform. We're very happy to share the further information on the report and the analytics included in the coming days, and we look very much forward to connecting either now or in the future around some of the themes, particularly ahead of the Financing for Development Conference and some of the upcoming opportunities to make sure that structural adjustments are able to build resilience moving forward. Thank you.
Well, thank you very much for that fascinating look ahead. And maybe, I don't know, for the upcoming conference, do you have, will you be the contact point for our friends here in the media? Would that be, or? Yeah.
The two hands that went up in the back row are your primary contacts, and of course, we'll be in touch both on the report and the GP, I think, with emails later today.
Fantastic. Thank you very much. Let me see if we have any questions online, and if not, we'll move ahead to announcements. Thanks so much. I think I've got, is Amna here? I don't see Amna's mic. Oh, there you go. There you are. Good to see you, Amna. So look ahead at what to expect in the final days of the World Health Assembly over this weekend and early next week.
Good morning. Thank you, Michele. So just a few words about the World Health Assembly that, as you know, is ongoing. Today we are on the day 5. The Assembly has already met in the morning and has awarded prizes to individuals or entities in recognition of their outstanding contribution to public health. The list of awardees is on the website. The plenary has also elected 12 members that are entitled to designate a person to serve on the EB that is going to meet after the Assembly next week. The Assembly has about more than a dozen of health topics on the agenda. So let me just highlight a few that might be of interest. In Committee A is going to take up the issue of mental health and social connection, and will also consider a draft global strategy on traditional medicine. The committee is also expected to adopt decisions on lung health approach, on kidney health, on sensory impairments, and is also expected to designate 17 November as a World Cervical Cancer Elimination Day. It will also take up the women, children, and adolescents' health, including the recognition of World Prematurity Day. In Committee B, there's going to be an adoption of an updated roadmap for an enhanced global response to the adverse health impacts of air pollution. More details about the agenda as well as the relevant documentation is in the media highlights that we have already sent you. As for tomorrow, the World Health Assembly is going to be meeting for half a day only. It will meet in the morning in the 2 committees. Midday events are going to take place as planned. Committee A will conclude the remaining work from today. It's not planned to take any new items, while Committee B is scheduled to take up a decision on lead-free future and lead mitigation, as well as to adopt a global action plan on climate change and health, among other issues. Monday, 26 May, is going to be a full day of work in the 2 committees, which are expected to take up the antimicrobial resistance and health in the 2030 agenda. As of now, Tuesday, 27 May, is scheduled to be the last day of the 78th World Health Assembly. The detailed program of works are going to be communicated via daily journals as usual. You can find them on the website and on the WHA app, and we will be sending media highlights as has been the practice so far. That's it from us. Thank you, Michele.
Thank you very much. That's it for you, but it's not really it for WHO. I don't think. No, I'm kidding. Thanks so much.
Thank you.
If there are any concerns over access over the weekend, please let me know. I think that we've informed security. We expect that all accredited correspondents will have access tomorrow to cover. So we've got Claire coming up next, and she's got a new WMO report on global temperature predictions for the next 5 years.
Yes, good morning, everybody. The World Meteorological Organization and the UK's Met Office next week will be producing their annual update on global temperature predictions for the next 5 years. It's called, somewhat confusingly, the Global Annual to Decadal Update, but it does cover the period 2025 to 2029. It focuses on temperatures, precipitation patterns, and predicted sea ice. We will be releasing this Wednesday, the 28th of May. We'll send out everything under embargo Monday morning at the latest. It's quite a technical report, but we will be having a technical briefing led by the UK's Science Media Centre. It's accessible to all of the UN journalists here. I will send you the link after this briefing so you can register if you want. The embargoed briefing is at 11:30 Geneva time on Tuesday, so I know that overlaps with this briefing, but I will send you the information anyway. Looking ahead a little bit further next week, the World Meteorological Organization and UNESCO are co-sponsors of a big international glacier conference that's being held in Tajikistan, in Dushanbe, hosted by the government of Tajikistan, which, as everybody knows, is very impacted by glacier retreat. Our Secretary General will be there. There is no big new report planned as such. You know, we issued our reports on climate and on glaciers earlier this year, but there will be a press release, so we'll make sure that you get that. And fitting in nicely with what our colleagues from the UN Office of Disaster Risk Reduction said, the global platform on disaster risk reduction does take place here in Geneva the week starting the 2nd of June. WMO, we are very actively involved at that. There will be a multi-hazard early warning stakeholder forum on the first 2 days on the sidelines of this platform, and we will send you details of that. One of the biggest natural hazards is obviously tropical cyclones. And yesterday, the US National Oceanic and Atmospheric Administration, National Weather Service, issued its predictions for the forthcoming Atlantic hurricane season. The NOAA outlook for the 2025 hurricane season predicts once again that it will be above normal activity. There is a 60% chance of an above normal season. NOAA is forecasting a range of 13 to 19 total named storms. And this includes 3 to 5 major hurricanes, so that's category 3 or above. If the predictions are correct, it'll be the 10th successive season that we have had above average activity. But as we all know, it just takes one landfalling hurricane to wreck economies, to ruin lives, turn back years of socioeconomic development. And if we cast our minds back to last year, the devastation in the Caribbean, which we saw from Hurricane Beryl, the catastrophic damage in the United States from 2 hurricanes, Helen and Milton. So, obviously, advanced forecasts, advanced warnings are really, really, really important as ever to save lives, to protect property. I'll send you out the figures in the briefing notes after this. Thank you.
Thank you very much, Claire. Any questions? Looking in the room. Look carefully online since I appear to have missed one earlier. Paula, I see your hand up.
Yes, it is.
Go ahead. Yeah.
So since I missed my question earlier to UNDRR, I'd like to ask you a similar question, which is regarding the defunding of a number of organizations, well, within the US, restructuring of NOAA and defunding of NOAA, as well as defunding of projects related to weather forecasting globally. I was wondering what the impact of that would be and how it may affect the early warning systems.
Okay. For that, I think I'll actually quote from the NOAA press release on the hurricane forecast. And this is a quote from the acting NOAA administrator, Laura Grimm, saying, NOAA is critical for the delivery of early and accurate forecasts and warnings and provides the scientific expertise needed to save lives and property. This is a follow-up quote from, if I can find it, sorry, from Ken Graham, who is the director of NOAA's National Weather Service. And he's the former director of the US National Hurricane Center. So Ken Graham said, in my 30 years at the National Weather Service, we've never had more advanced models and warning systems in place to monitor the weather. This outlook is a call to action. Be prepared, take proactive steps now to make a plan and gather supplies to be ready. The World Meteorological Organization, we continue to collaborate very, very, very closely with the United States, with NOAA, with the National Weather Service, with other parts of the US. They are very, very valued, very constructive, very important members of the United States, of the World Meteorological Organization. Obviously, we're monitoring the situation. We're not complacent. But as I said, we're committed to continuing to work closely with and in support of the United States. Thank you.
Thank you very much, Claire. I don't know whether there's a follow-up or whether there are other questions to Claire from our community online. Just scrolling up to make sure I don't miss anybody. It appears not. Thank you very much. I've got a few remaining announcements, and I will come back to you, Paula, on the question that you asked with a contact. The first announcement is on behalf of the Human Rights Council. The Human Rights Council says that the Intergovernmental Working Group on the Right to Development will hold its 26th session from the 12th to the 15th of May. The session will be held in the Tempest Building at the Palais des Nations. The UN High Commissioner for Human Rights, Volker Turk, will open the session on Monday. Something odd about the dates, I think. But anyway, let me come back to this announcement as I feel like there's something a little bit wrong about the dates on this. Probably they mean June, but I'm gonna check about that. There's an announcement from UNESCO that is inviting everyone to the open air exhibition From Geneva to the World, a journey to transform curriculum and learning, which will take place along Kay Wilson in Geneva throughout the month of June. You're invited to wander the open air gallery and trace the UNESCO IBE Global Journey. IBE is the International Bureau of Education, which began in 1925, so it's now 100 years old, in pursuit of inclusive, resilient, and future-ready education. There's an opening of this exhibit. It takes place on the 3rd of June at 2 p.m. at La Buvette Trompette on Kay Wilson, and there's an online registration form that you can fill out before the end of the month. There's a meetings update on the Committee on the Rights of the Child, which continues through the 30th of May. It's concluding this morning its review of Brazil. And we also have the Conference on Disarmament, which will announce the date of its next public plenary meeting. And I believe that the next under the presidency currently is under Kazakhstan and will be followed by Kenya, Malaysia, and Mexico. The current session of the conference goes until the 27th of June, and then there will be another session from the 28th of July to the 12th of September. I think that that is all I have for you. We invite you to follow the UN Security Council stakeout today, at which we expect the UN Secretary General to speak. It's on protection of civilians. We expect that he will speak on Gaza at that occasion. So please follow that on UN Web TV. I don't have an exact time for that. The meeting in the security. Sorry? 10:20. Thank you very much. Excellent. So it's been posted. So thank you. I think that that probably wraps it up for today. And I wish you a great rest of the day. Thanks so much. Bon weekend.